This segment really needs to focus on what actually happens in the chair for the hygiene care team. And if I was to ask a question to predominantly the hygienists out there, do you really know what your patient wants? It's a great question. And our goal always is to give the patient what they want, also in a framework of what they need. So let's talk about what we do know. And a lot of this is kind of statistically proven in terms of what patients want. Chris Add has great data on feedback from patients. And here's what we know. And what we know should then translate into what we do. Because if we want to get in the minds of our patients where we need to be able to embrace the fact that if we're giving patients what they want, they're going to become loyal patients. They will come back and they will refer other patients to our practice. That's what we want. Now, we're trained as clinical operators in what to do as far as treating disease, how we actually do our procedural work, technique-wise, on and on. And the great benefit, health benefits we receive from giving this state-of-the-art treatment. But unfortunately, it does fly in the face many times in terms of what a patient wants. If a patient doesn't get what they want, they won't continue to get it. They won't return on a consistent basis. So let's talk about what we can do here to kind of marry those two things together. A patient does not want to be in the chair more than 52 minutes. We know that. A patient absolutely does not want to be hurt. Now, for those of you who believe that what the patient experiences as far as the pain they go through in terms of doing what you have to do to have a thoroughly cleaned mouth, to use the word cleaning, unfortunately, that isn't the goal. The goal is to do what we can do within a reference to what the patient will tolerate. Now, if the patient will tolerate 52 minutes in the chair, which is really sounds odd, but that's really, at that point, most patients have had enough. So our goal would be to do what we can do within 52 minutes. And doing what we can do in 52 minutes, we have to embrace the fact that it's got to be comfortable. So if we're hurting patients, we need to know very clearly that you cannot hurt patients. Now, for somebody who would think that they need to do what they can do as a hygienist, to do proper soft tissue management, because that's what you're told, it's an absolute practice killer. So what we need to look at is do what we can do in terms of what the patient, number one, will tolerate, but most important, even one step further than that, what they will accept. So if somebody is actually having those patients in the chair that are okay with having their teeth cleaned with a lot of pain because they feel they get a better cleaning, you better know that, because a lot of the ones that you're hurting will just not return. So it's very important for hygienists to realize it's a very difficult job that they're doing, and we need to appreciate that. The dentists need to appreciate how difficult this is. So we need to do what we can do to make the patient very, very comfortable. And it's not make them as comfortable as possible. It's about making them comfortable, absolutely well within their tolerance zone. That requires, then again, here we go again, it requires communication. It requires face-to-face and trust. It allows the patient to communicate directly to you what they will or won't tolerate. Because very often, if they don't trust you in terms of the relationship that you must build face-to-face, there is no treatment that can occur in a practice, I believe, without having a trusted relationship with your dentist, with your hygienist, in fact, with everybody on the whole team. If you have that, you're then going to be able to identify what the patient needs, what the patient wants, and where the patient's comfort is. And when you do those things, you're going to end up with a very loyal patient. Now, I know this really is something that will cause a lot of hygienists to push back, but the data is clear. It's not attached to a specific person, or it's clear that's what it is. So if you want to have a successful business that revolves around your hygiene practice, which they all do, to get patients embraced to come in, to get their preventive care in their tolerance zone, and then to return as loyal patients and get their dentistry done as well, we need to recognize the fact you can't hurt them. You got to get them in and out on time. And the schedule and all of the other processes and systems in the entire department need to be focused on that.